Good evening, students. This is
Hello.
Dr. Hemanth Kumar. I'm the faculty for medical oncology at Dr. Tutorials. And today, with the Neet SS results that have come out, I'm actually thrilled to see the ranks coming up in the chat box. It just feels like yesterday that I cleared my exam and I was getting ready for my DM. And I can feel the enthusiasm in all the students when they post their ranks. And to discuss in the same way, I have with me here Dr. Soumya Singh. Welcome, Dr. Soumya.
Thank you so much. Good evening, all.
Yeah, yeah. So, Dr. Soumya Singh has secured All India Rank 4 in Neet SS Medical Oncology Group. And we are going to have a quick chat with her on how probably she decided to proceed with this subject, how probably she prepared for the exam, and how Dr. has also helped her. Hearty congratulations, Dr. Soumya. I'm super
Thank you.
proud that you got this rank and you very well deserved it. There's a lot of effort that has gone behind, which probably others don't know. To start with, just let our students know your background. So, where you've done your undergraduation and post graduation, and what you've been doing.
Yes, sir. I've done my MBBS from MP Shah Medical College, Jamnagar, sir. And I've done my post graduation in general medicine from BJ Medical College, Ahmedabad, sir.
Okay, fantastic. So BJMC has been always one of those top medical colleges for MD medicine, and a good number of people coming up for medical oncology from that place. So, what probably inspired you to take up medical oncology? How do you do this? There are a lot of branches, there are a lot of new branches coming up. You'll have taking general medicine is probably one of the easiest decision to make on day
Yes,
one of my second year MBBS. I knew that it was going to be medicine, but
yes.
after that, how probably did you decide that it was going to be medical oncology?
As you said, sir, choosing internal medicine was not at all difficult. Matlab, in internship only, I knew I have to go for this only. But after general medicine, choosing a super specialty field was difficult for me because I loved studying internal medicine as a whole. Restricting it to a particular thing like cardio and neuro, and I was finding it very difficult. So till last moment, till my university exams also, I was ki I will not go for any SS program. I'll just stay MD medicine only for the love of the subject. But later, when I studied about it and I read medical oncology, it comprises the whole body, as was the
Right.
essence in general medicine. And for personal reasons also, I've lost my grandparents to pancreatic cancer, to testicular cancer. So I could relate to the sufferings, the
Yes.
relatives face of those patients, the kind of helplessness, So I found it like that's my calling and I should go ahead with medical oncology only.
Yeah, I think I totally agree with you. I think all of us have some parts of everything. So I absolutely loved internal medicine, and I was somebody who was like, I'm not going to do probably DM at all. But I have my uncle and my cousin who are already DM, one is a neurologist, others an oncologist as well. So there was definitely a lot of pressure on that super specialization. So that you're not probably going to stay. And exactly like how you told, I do not want to restrict myself to one organ, one system. Okay. So at the same time, probably the two shortlisted ones for me were oncology and infectious diseases. Now the problem with infectious diseases I really like because it was something new. Okay, fine. That was the first year aims for starting the DM programs. I was really keen on. But the concern was once I came back, I would be associated with the hospital. Okay, I might not have my independence, and I'll be competing with the physicians and other team, intensivist, everything. So where would I get my security of work? Okay. So when you talk about security of work, that is where I think medical oncology is one of the most secure fields. Okay, this is for all the students out there. Not discouraging for any other field. Choose what you like, but oncology is one very secure field. So when I tell about probably rheumatology, I think orthopedicians, physicians end up treating a lot of these cases, right? But when it comes for the diagnosis of malignancy, the next step is don't do anything. ask a medical oncologist or ask oncologist opinion, right? So it is a very secure field and probably a safer field as time goes by. And definitely you will end up seeing a lot of medicine there. I've had a patient today who's got pulmonary thromboembolism. I've got a patient today who had gemcitabine induced TMA leading to AKI. So you have real extremes of thing. Okay, hepatic encephalopathy probably every week I would see. So you will have definitely lot of work going on with your medicine colleagues as well. Plus, you will end up seeing every other system. So you need to be really good in medicine for being good in medical oncology. And like how you told that your grandparents had malignancy, same way here, my dad's brother had acute leukemia, and my parents were always kind of had gone through how difficult the situation is at times, okay, and how the support is needed. And I think I feel happy that you got rank 4 and your grandparents will be super super proud of you that you have secured this. This is probably a intern respect for them, okay. uh, I totally get it how it feels being there. Okay, fine. So, what was your exposure during your MD medicine? The problem with oncology is not a lot of students get medical oncology exposure. So, how was it in BJMC? BJMC being there and GCRI being there, I assume that you would have got, but how was it?
We get rotations, sir. But in my time, actually, I was getting district regional posting at the time when my oncology posting was scheduled. So I was not able to attend that. And I gave the previous need also. And in that, I secured a rank of 226. But I was not getting Tata Memorial or GCRI options for that rank. So I chose to go ahead with my bond service, and during my bond duties I prepared for this. And just a month back, after giving INICT, I took leave from my duties and gave a 1 month full preparation for this exam, so
Right.
so
Yeah.
honestly speaking, the practical exposure of working in medical oncology, I haven't been much exposed to that field.
Yeah, yeah. But at least you had a decent, good idea. So all students probably who are listening, I think for any super specialty field, I would definitely recommend that you work in that field for some time so that you know it well before you take it up, because this is what you're going to do for your life. So it should not be like you enter and then like am I not sure what it is. But I think with you, I am definitely confident it is going to be oncology. Fine. So you finished. So you gave your last Neet SS, right? Okay. So so you know how the Neet SS has been, and I find it more unpredictable these days on how to predict the Neet exams, right? What do you think of the examination that was the last time and this time?
Sir, there was a complete 180-degree twist, I would say. Last time I somewhat focused on systemic oncology much, but there was just one-liner factual questions with the, we cannot be sure of any of the options. And this time it was hardcore long STEM clinical questions with closely knit options. So this was totally unpredictable. But and the questions focused mainly on head and neck surgery, head and neck onco part, with which most surgery people could relate regarding the margins and all. But the exam was totally unpredictable. INICT was predictable, means the questions remain the same from the same topics. You can prepare for that. But
Yeah.
this time it was just full of updates and practical knowledge and clinical STEM, long STEM questions. So,
Yeah, so INASS is always kind of has been good. We've been able to kind of understand how things are and how probably to go about, and logical questions most of the time. Okay, fine.
yes, sir.
Whereas in Neat SS, it is unpredictable. The last time paper was definitely terrible. This time, at least, it probably it made more sense. It was slightly
Yes,
more advanced because a lot of updates, everything had been asked. But last time, a lot of questions on AI and some out of the
we were
blue
vague.
box, it's
Yes,
very
sir.
vague. So one could not probably really prepare, right? So we had a difficult time in kind of really understanding how to get students prepared. So I would want to know how probably you came to know about doc tutorials and how probably you went about.
After giving my last exam, I felt that I needed more practice with solving questions, giving GTs, and I was lacking in that part. And doc tutorial has lots of questions in the question bank to practice and plenty of grand tests. Uh,
Some issue with the connection.
yes, sir.
Hi, sorry, I think there are some network issues. So I think I just reiterate what we were discussing. So we were thinking you had it in two meters. So one was the last time and this time, and where probably doc
Yes, sir.
tutorials came into play and how probably you came to know about it.
After giving last SS exam, I felt that understanding the topics in depth, which come flowchart like that, and reading the theory is a different aspect. But when the clinical STEM, clinical vignettes come, what next best step should be taken, that requires practice, a lot of practice. You get the essence of a particular statement in theory only after solving some questions. So I had plenty of questions, which we can solve, and plenty of GTs. In last 1 month, I had plenty of GTs to practice. I gave a GT every alternate day, and used to make notes that I do this question repeatedly wrong. I maintained my wrong questions diary, which I read the last night before exam.
Yeah, I totally agree. I think whenever you practice, I think solving the questions time based, trying to understand probably what concept you are dealing with, try to go around the concept and see what are the possible potential questions to be asked, because you cannot know everything in oncology. Okay, it's impossible for us also to so no. So actually, at times when students post a lot of queries in the group, we have to go. read back and come back, because in the current era where you have got access to up to date AI and lot of study material, so it is difficult for us also, so we end up reading as well. Okay, so we end up learning a lot from you. So all these questions are basically based in a way that how
Yes, sir.
probably certain scenario can be handled and probably be done. The questions are done that way, and there's a good team that is working between behind the cube, and we are trying to improvise it every other time. So that is something that has been there. And I agree, I think GTs are very important, because you know that
Yes.
you have keep a track of the time and try to kind of solve it well, because you need to be in the mode of exam before you actually go to the exam. And the other thing that your wrong question diary is extremely important. What happens is whenever we end up solving a lot of questions in a day, we probably are not really looking at what went wrong. So it's extremely important that you know what went wrong and work on that. It is definitely something that all should keep in mind. Also, I think you are part of our WhatsApp chat group also, and
Yes, sir.
sometimes it is overwhelming in that group when lot of questions keep coming. Do I really need to know
Yes.
this or not? Sometimes it is scary for us also. So we end up learning a lot, but it is difficult sometimes on how to go about. What is your opinion on that?
That group was extremely helpful on some days when we feel low after scoring a low score in GT, and then you open the group and you say, see that many people are asking so many questions, so many new topics, and you people are continuously answering that, and that used to motivate me. I should be on the track right now and not feel demotivated. That was a totally new learning experience, sir. And also, till the last day, people were asking the previous neat questions, sir, what to answer on this, what to answer on this, and you people just continuously help that. Just go with the flow and answer this. That was very supportive and cooperative, sir.
Thank you. I think the work cannot be done by me alone. I think Vijay and Kiran, my both my colleagues and
Yes, sir.
my very close friends, they have worked the more harder. They've given everything from their side. I had been probably a step
Yes.
behind this time, but I think I will be back more frequently. But this team basically tried to. I think we end up having a more emotional connect with all our students, plenty of students whom I know really well now because of this, and I kind of really hope to meet them there. So, what probably is your suggestion on how we could improve upon? We know that we cannot be perfect. Okay, we cannot be perfect, and it is evolving. Even we are learning every other day. So, what is your suggestion on how probably we can improve upon?
So, firstly, I would like to point out that previously the GTs mainly used to focus on chemotherapeutic drugs. But as soon as NEET 24 happened and we saw the type of questions, the GT questions were entirely changed according to the latest questions that were asked. So, that was quite helpful. As far as the question bank is concerned, sir, in some parts there are plenty of mistakes in the answer, which we have pointed out to be corrected. That needs to be corrected. Apart from that, the explanation given below the answers is really helpful. Even if you have not read that particular part in theory, you can get pretty much idea of that topic after reading the explanation below the answer. So that was very important, and some questions directly were asked from those explanations that I have studied. So that was quite helpful. Uh, Apart from that, the latest GT questions that were just lastly held, the question style was more or less similar to the what questions were asked in the present NEET. The clinical vignettes type, the long step questions, what next best step has to be taken. Those questions were included, and yes, that's it, sir.
Yeah, so especially the last GT, we were also involved, because on all the tests we cannot be involved, but at least we try to focus and see what best. At least there are very important tests that probably we are a part of. Team. There's a big team working behind the Q bank and this thing. It's not only three of us. Okay, there's a good
Yes, sir.
team that is working in doctorals for preparing a good quality question bank. Yes, I do agree that erroneous and ambiguous questions occur, and we also probably have to go double check and try and see. and that is an evolving process, and I think that is going to keep evolving. There will be some mistakes happening, but we will definitely rectify. And more importantly, I'm very thankful that all of you are kind of letting us know that these are probably the changes need to be made, and that is probably what we have to look at, because that is how we are going to learn from you and you are going to learn from us, because it is a mutual effort. It is not like how probably for MBBS it was or for MD it was. For super specialty level, you are as good as us. We never see you. Probably you're just a junior student who is trying to learn from us. No, every day it is a learning process for us as well. So I think that is where we've been trying to evolve over the years and try to see what best can be done, and that is why we needed the team expansion as well. So we only me and Dr. Vijay were part of it. Now we have Dr. Kiran, and we are trying to see how better things can be done. So all India rank 4 sounds fantastic. Now when you get such a good rank, the decision making becomes more difficult, what to choose, where to choose. Okay. And I think any institute is in your hands right now. But more importantly, what are you looking forward to?
I'll be going for Tata Memorial, Mumbai, sir. I have my husband working there as surgical oncology resident, so I'll be
Fantastic.
joining this.
Ah, yeah. I think that is the most important thing that needs to happen. You will be joining him soon. Okay, I'm super happy for you. Then that this result was much more important that way, that you do get your seat there, and very happy for you. I think going ahead, we are going to have a lot of publications, good work that is going to come from you. Recently, if you see, Dr. Adip Arora had published the pembrolizumab paper, the low dose pembrolizumab paper. He was our student a year back also. So when we were teaching, we never realized what probably we are going to see ahead. But it's really nice to see that my initial set of students have kind of now cleared DM, they're back working. And some of them, when I post a difficult case in one of the national groups, one of the students actually gave me a suggestion on how to go about working this case. Okay. So we are really happy, and definitely, Dr. Soumya, I am super excited for you joining TMH. It's the best place. Definitely, it is the best place. It is going to be hard, but it is definitely, you should work hard. You should work hard. I think the next 3 years matter, because this is where you're going to learn whatever is needed for the entire life. Okay, this is one chance that you get. And one of my students there, Dr. Mahek, is there, and she was always smiling. I used to be scared of TMH. Like, why do you want to go to TMH? She was like, sir, it's just 1,000 days, 1,000 days of my life, and I will enjoy my every day there. So it's okay. So 1,000 days, I'm going to kind of really work hard, because at the end, when you come out, you're going to be probably the best ones out there. So I am really looking forward for big presentations, big papers coming from you, and I know you're definitely capable of it. Okay. So this is from me, Dr. Vijay and Dr. Kiran. Really hearty congratulations, and from the entire Dr. Tours team. Uh, Looking forward for your bright future, and definitely we will be calling you later on once you're getting out of the DM there, and probably helping us out in whatever way you can to give back to the students on how we have been doing. So that is it from Dr. Tutorials. I had a real good time talking to Dr. Soumya. It is an evolving process, and we have been trying our best, what best we can provide and be there, because it is a journey. It's been a 1 year journey for you as well, I think, and for us, it's been now over 4 years now. So every time somebody gets a rank, we are very happy for you, and that is what we kind of really hope for and wish for. So thank you, Dr. Soumya, for again sparing your time joining us. Wishing you all the best, and the best uh, work from you. Keep working hard, be extremely humble, learn to care for the patients, because that is what is going to matter end of it. Each individual patient will look up to you as somebody uh, whom they can emotionally connect, and they hope that you are there for them. So keep doing that. It's a learning process every day, enjoy the work that you do. It is going to be really hard, but enjoy the best you can. So all the best, and thank you for joining us. That's it from me, Dr. Hemanth, from the medical oncology team of Doc Tutorials. Short interview, but a fantastic time. I am smiling heartily, happily. Thank you, and
Thank you
good
so
night.
much, sir. Thank you so much, sir.